Hi, my name is Beck, and this is my Educated Citizen Portfolio for the traditional BSN program for December 2022. My public issue is vulnerability in pregnant and postpartum women in Nebraska and the lack of access to healthcare and education. Poor prenatal care can lead to many problems and increased costs, and this is why it's so important to protect women and their unborn babies. Women without prenatal care are 7 times more likely to give birth to premature babies and 5 times more likely to have infants who die when 2017. A healthy newborn costs on average $1,000, and a premature newborn with problems can average around $79,000. And hospitalization for 1 year can be $500,000 to millions. So a woman who's already vulnerable may not get prenatal care, and when she gives birth to her baby, that baby may need to be in the hospital or stay in the NICU for some time, which will cost her even more money. So if we can provide support to these women and their unborn children, or after in the postpartum period, we are helping both child and mother in their futures, because children, infants, and the unborn are the future. My personal connection with this issue is at Methodist Women's Hospital when I was a CNA on the mother-baby floor. I had many different types of patients. Some of them were young, some of them were older, and a lot of them were vulnerable women, teenage girls. A lot were low socioeconomic status, little education, little to no support, and a lot of them made poor health choices like drinking alcohol or smoking while pregnant. And I believe this is because a lot of them didn't have education. They just didn't know that it was wrong to do that and unhealthy to do that. So I think it's so important that this is kind of changed and these women are given support. An effective communicator uses critical thinking to generate, connect, and organize ideas in a written, oral, and nonverbal manner. And this is from Nebraska Methodist College, 2014. I was an effective communicator when I was assigned to an autistic nonverbal patient in my med-surg clinical in 2021. I taught her simple American Sign Language to help her communicate. She was not able to communicate with me, with the nurses. She couldn't write or really say anything, and she was very scared. She was in the hospital because she was waiting for placement to a facility. And I thought that I could teach her American Sign Language, just some simple signs to help her communicate. And so I taught her signs like more, food, drink, please, all done. And this helped her communicate with the staff and with me. And she really seemed to calm down after that, because before she was very angry and frustrated that she couldn't communicate. I learned in this to creatively apply my skill of ASL, which is a form of communication other than verbal and writing. How I can apply this is I can use creativity and alternative forms of language to communicate with a vulnerable pregnant or postpartum woman. The second time I was an effective communicator was when I did the Elder Project for Nursing 462 this semester. I interviewed my grandma, who's right here, and I created a book about her life, and it has stories and pictures of her. And I also did a comprehensive assessment, and I wrote a paper about that. And that contained information about her living situation, her safety, medications, and history. Lessons that I learned in this is that I learned how to use creative ways to communicate with the older population. Some things I had to change when I was working with my grandma is I had to talk just a little bit louder, a little bit slower. I had to wait for her to respond because she was a little bit slower because she was on hospice and not doing too well at the time. And I also learned how to gather large amounts of information in a short meeting and compile it in an organized way, and so that my grandma was able to process what was going on. How I can apply this to my public issue is I can adjust communication techniques to each person's preferences, or abilities in the vulnerable population of women. So next, reflective individual. A reflective individual routinely engages in habits of inquiry that influence ways of thinking and actions. Nebraska Methodist College, 2014. So the first thing when I was a reflective individual is priorities in nursing school and life. In fall 2021, I overcommitted myself. I was an SI instructor, and I committed to 2 semesters to teaching 2 classes of that. I tutored for many classes. I was a babysitter, a nanny, I was a CNA, and I had all of my classes and clinicals to do, and I was very busy, and I had no work-life balance at all. I was very stressed, and I almost couldn't do any of my work well because I had too many things on my plate. I had to say no, and it was hard to do, but it was a very good lesson to learn to reflect on the priorities of my life and say no to things to bring greater focus to the priorities, and it helps me maintain a better state of mind. I can apply this to my public issue in a way that I need to examine my own life, priorities, and beliefs in order to help those who are vulnerable that may believe differently than I do. I also need to make sure that I have a good mental health before caring and supporting others. The second time when I was a reflective individual, when I was in my geriatric semester earlier this semester, and I was on the acute care for elders floor when I made a medication mistake. In this experience, I had a patient who had over 20 medications, and I was checking through the medications and pulling them out of the Omnicell, and I accidentally pulled one out that was not on my patient's MAR. The second time I did the medication check, I realized that I had chosen the wrong medication. So I went and got my clinical instructor, and we were able to put it back. Some lessons I learned from this is taking personal responsibility for my mistake. It would have just been easier to have not made that mistake, but now that I have made that mistake, I double, triple check all my medications and to make sure that I don't do a med error. In checking these medications multiple times before administering, I caught the mistake and avoided a medication error, which would have been really bad in this instance. I can apply this to my public issue in the way that I can exhibit personal responsibility with my words and actions when talking with vulnerable postpartum or pregnant women. I learned that admitting my mistakes is very good to do, and I was able to offer to help my clinical instructor in putting it back. A change agent uses the disciplines of the liberal arts and sciences to analyze historical and contemporary situations and systems, to develop cultural competence, and to take appropriate initiative to effect change. Nebraska Methodist College, 2014. A time when I was a change agent is called Night to Shine Prom. I attended a prom for kids called Night to Shine, and it's sponsored by the Tim Tebow Foundation. And I was paired up with a boy who had autism. He didn't have very many friends, he was telling me, and he seemed very nervous about being there. I learned to demonstrate respect and kindness for him and just be friends with him because he didn't have very many friends and he was very nervous. I also learned to create a voice for this boy with autism because he was unable to communicate his needs throughout the night. I could tell he was very overstimulated at times. And so we would be doing a game or something, and I would say, hey, let's go over here where it's quieter. And I could tell that he really appreciated that because he wanted to tell me that, but I could tell that he just didn't know how to say it. I can apply this to my public issue in the way that I can assess the needs of the vulnerable population of women and help to create a voice for them by helping them find resources and support. The second time when I was a change agent was this semester in geriatrics when I helped a hospice patient. I was in a nursing home helping on the skilled care floor, and I cared for an older woman who was on hospice care and she was actively dying. She was having air hunger and having a really hard time breathing. And I learned how to create a voice for her and advocate. When I could tell she was really struggling, I sat with her and I held her hand and I just talked to her and helped her feel comfortable. I also remembered that I could help her by giving her medication. So I went and got the hospice nurse who was on call that day, and we decided to give her some medications to help her feel comfortable. I learned how to take appropriate initiative to affect change in this instance. I also learned how to get out of my comfort zone. I was very uncomfortable with doing all of this, and I was so nervous because I had never seen anyone die before. And it was frankly very scary. I can apply this to my public issue in the way that I can help create a voice for vulnerable pregnant or postpartum women who are scared and advocate for them by helping them get resources. I can also help to create a voice for the woman's baby or unborn child by helping care for their mother and prioritizing her health and safety. I would call myself an educated citizen in the making. Each experience in nursing school at NMC has offered me to grow as a holistic person and future nurse. Here's a picture of me with some of my nursing friends. Each educated citizen reflection has applied to my issue of vulnerability in pregnancy. And this is not because I planned all of these topics my first semester in nursing, because I didn't. And I had no idea what my public issue was going to be 3 years ago. The topics of effective communicator, reflective individual, and change agent can be applied to every single area of life in some way. The educated citizen content in the curriculum has allowed me to become a more rounded individual, and I look forward to continue growing as an educated citizen in my career as a pediatric nurse. And here are my references. Thank you so much.